Hello there! Hello nurses and hello world! This is nurseniezl and welcome back to my channel! Video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's websites. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the OSCE examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And yes, today I'm going to show you how to write an evidence-based practice. And today's topic, we're going to talk about smoking cessation. So before we head into it, please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. And if you got a question for me and you want your question to be popped up to the top and I'll be able to see and answer those questions as soon as I can, then hit the join button. That's one of your perks as members, okay? Another perks of the membership is that you will be able to see the videos before everybody else. Please hit the join button to join the membership. In order for us to understand what we are going to talk about today, which is the topic of smoking cessation, let us first define the terms. Smoking is a practice in which a substance is combusted and the resulting smoke is typically inhaled to be tasted and absorbed into the bloodstream of a person. In other words, smoking is when you inhale and exhale smoke from burning plant material that's rolled into a wrapper, which what we call cigarette. Smoking is when you light the end of the cigarette and pull smoke into your mouth through the other end. It travels down your airways into your lungs and through your bloodstreams to your brain and other organs. But why do people smoke? People smoke because they find it enjoyable and because it's hard to quit once you start, and this is despite the damaging effects of smoking on your body. This is because of your brain's cravings for nicotine. Nicotine makes you feel bad when you don't get it. Now here are the smoking health risks. Atherosclerosis or coronary artery disease. If you are smoking, you might have cataracts and loss of eyesight. Another risk could be periodontal diseases in your gums, breath, and teeth. It will also cause reduced fertility, such as impotence, erectile dysfunction. As part of your smoking health risk, this may include asthma, aging and facial wrinkles, chronic obstructive pulmonary diseases or COPD, which includes emphysema and bronchitis, rheumatoid arthritis, and most of all, several cardiovascular diseases. Ulcers, cancers from your lungs, mouth, kidneys, pancreas, bladder, throat, and esophagus. It can also reduce life expectancy. The best treatment to anyone who's smoking will depend on their personal preference. Research has shown that there are methods that can be very effective when it comes to smoking cessation. The first one we have here is the nicotine replacement therapy or the NRT. This is a medicine that provides a low level of nicotine without the tar, carbon monoxide, and other poisonous chemicals present in tobacco smoke. It can help reduce unpleasant withdrawal effects such as bad moods and cravings which may occur when you stop smoking. E-cigarette is the most common electronic device that delivers nicotine in vapor. This allows a person to inhale nicotine without most of the harmful effects of smoking, as the vapor contains no tar or carbon monoxide. Evidence-based practice is a silent or a writing station, in which you will be given 10 minutes to write in silence. Now, how are we going to write smoking cessation as part of our evidence-based practice? So when you get to your exam, you will be given a scenario in which it's a full-length research that you have to read through. So the scenario revolves around the patient who is under your care and you are the nurse. So this patient is undergoing a nicotine replacement therapy because this patient wants to stop smoking. So there's an argument between an e-cigarette and nicotine replacement therapy. So you as the nurse, you will be given 3 studies comparing nicotine replacement over the use of e-cigarettes. So basically, that's where the scenario evolves. But again, it's lengthy, okay? So you have to read through that. And now I will introduce you to the marking criteria from the NMC. And you will have to memorize this, okay? You will have to memorize this because marking criteria is the Bible for passing your OSCE exam. Now, with too much things that you need to consider, you need to study, you need to memorize all of the marking criteria from your APA, evidence-based practice, professional values, plus the other skills. You've got 21 things to learn. How are you going to manage it? So with this evidence-based practice and with these professional values, we really need to make sure that we highlight the keywords so we'll know what to write during the actual exam. So this is why I'm here, okay? I'm going to show you how to write an evidence-based practice. I'm going to make it as short as I can, okay? To help you remember those keywords that you need for your exam, especially when you're about to take your evidence-based practice, okay? Specifically, smoking cessation. Are you ready to highlight the keywords with me? Yeah? Okay. So again, I'm gonna put back the marking criteria right over here. You need to learn them by heart. But let's start highlighting the keywords, okay? So we know those keywords will lead us to the answer during your exam, during your evidence-based practice station, okay? So let's start with this one. Yeah? Can we highlight the keywords here? Yes, we can highlight the replacement therapy plus yes, achieve the same level of satisfaction. Not just that, you can also highlight this one. Yes, e-cigarettes have higher rates of satisfaction. You can highlight those words. How about this one? Let's give it a try. Stopping smoking is more likely when using e-cigarettes compared to nicotine replacement. How about this one? Yes, so the next one would be stopping smoking is more likely to cause throat and mouth irritation. Yeah, those are correct. Yes, you need to highlight those words. How about the next keyword for this one? Yes, nicotine replacement, nausea. And how about this one? Let's give it a try. Without face-to-face support, there's low efficacy on both treatments. So you have to highlight those words. And can I also add this one? Smoking cessation service. So I know now what to write. I'm just gonna add some pointers when I'm gonna write on my exam, in case I'm gonna take an evidence-based practice exam. Okay, how about the last one? Yes, offering support and encouragement. So highlight those words, and when you get to your exam, you can just add to it. Yes, that's it. So basically, those highlighted keywords that we've just done, just remember those terms, and that would remind you the correct answer to write during your OSCE exam. Now, are you ready to write your own answers? So I'm gonna need you to pause this video. I'm gonna give you 10 minutes to write your own evidence-based practice. So I'm gonna flash here the scenario, the sort of like scenario. We've discussed the highlight. You need to memorize those keywords that we've highlighted. And yes, you need to finish this station within 10 minutes. So I'm gonna start the time. So, are you ready? Time starts now. Oh, hello, you're back. Okay, have you written your answer? If so, I'm gonna reveal also my answer, but just a disclaimer, this is just my answer and my own opinion. I have done my research, and just in case I go to the exam and take an evidence-based practice regarding smoking cessation, so this is going to be my answers. Again, I've done my research. You are entitled to your own, and this is just my answer. I'm not saying I'm correct. I'm not saying I'm gonna pass the exam. I'm just saying these are just based for my own opinion. Are you ready? Yeah? Before we head into it, I would like to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, click the notification bell. Also, if you want your question to be popped up to the top and I'll be able to answer your question as soon as I can, then hit the join button and become a member. Also, comment down below what other OSCE videos you want me to do next. Yeah? Alright, here are my answers. Enjoy! Alright, nurses, remember to follow the marking criteria. You have to summarize the main findings from the article summary. You also have to draw conclusions. Next is to make recommendations for practice. Write clearly and legibly. I will tell the patient that replacement therapies have not been found to achieve the same level of satisfaction as smoking. However, e-cigarettes have higher rates of satisfaction compared to nicotine replacement. I will inform the patient that stopping smoking is more likely when using e-cigarettes than nicotine replacement, as studies show. I will tell the patient that e-cigarettes are more likely to cause throat and mouth irritation as compared with nicotine replacement. I will inform the patient that nicotine replacement therapies are more likely to cause nausea. I will highlight to the patient that, without face-to-face support, there is low efficacy for both treatments. I will recommend that the patient use a smoking cessation support service, signposting them to the local service. In conclusion, I will positively acknowledge the consideration of giving up smoking by offering support and encouragement to the patient. And just like that, we are now finished with the smoking cessation. I hope you learned something for today. This has been nurseniezl. See you on the next one. Bye! And here we go again on our shout out section. Congratulations to the new OSCE passers. Congratulations to at Ade Jokeyo Luwoli 3156. Welcome to the register. Likewise goes to at John Scott 8374. Congratulations. And we got here at Kelechi Jokoro 3628. Again, welcome to the register. I also wanted to give a shout out to Joey Hayuyay. Welcome. Hello there, Olowokeri Taiwo Atinoki. Welcome to my channel and welcome to the team. I'd also like to welcome Vandana. Hello there, Vandana6273. Likewise goes to Lola Imiden. Welcome to my channel. Last but not the least, we've got Ayesha Musti. Welcome to the team, guys. Oh, look at that. We've got one more. Benjamin Vargas. Hi. Hi there. And welcome to the team.